Sinda, and I will be doing the return demonstration for shampooing the patient's hair. So to start off with this procedure, we're gonna assess the patient's hair and scalp to determine if the patient's hair and scalp is healthy enough or capable enough to apply the shampooing procedure. So we're gonna assess the patient's hair and scalp and see if it's healthy enough. And seeing that there are no abnormalities in the patient's hair, we're gonna proceed with the procedure. So before starting with the procedure, we need to make sure that the equipment that we need is prepared so that we wouldn't get any kinds of obstructions. Then to start off with the procedure, we're gonna remove the patient's pillow and we'll make sure that the patient's head is under or at the edge of the bed. So I'm gonna remove the pillow from the bed. Support your head so that you won't get hurt. Then place a linen under the pillow, under the patient's head. Then, considering that, or we're gonna assume that this is a inflated galley, I'm gonna put it in or under the patient's head. Okay. Then I'm gonna put a towel from the shoulder to the clavicular area of the patient so that he wouldn't get wet. Then we're gonna need to put a cotton balls in the patient's ear so that we could avoid water from entering through the patient's ear. Once it's in, we also need to provide a towel to cover the patient's eyes to also avoid water from entering from the ocular or eye area. After that is, we're gonna wet the patient's hair thoroughly. Then after wetting the patient's head or hair thoroughly, we're gonna apply a little bit of shampoo. After applying shampoo, we're gonna need to rinse it thoroughly. After rinsing it thoroughly, we're gonna need to rinse it with water to remove any shampoo. And if you'd like, you could also use conditioner to make the patient's hair more healthier. patient's hair, we're gonna need to dry it thoroughly. After drying the patient's head thoroughly we're gonna remove the towel, the washcloth that we put in the eyes, and the cotton balls that we put in the ears. After drying the patient's hair, the ears, as well as the eyes, we can comb the patient's hair, or you can also ask the patient's assistants if they're willing to do it themselves. After combing the patient's hair, we're gonna need to put the patient in a comfortable position. Then remove inflated jelly and put a pillow under it. After making the patient feel comfortable, we're gonna remove any we're gonna discard any equipments that we've used and document any relevant data that we got from this procedure. Thank you.